Hi, Dr. Randall Kraft here, double board certified Harvard trained plastic surgeon. Today I want to address one of the most common questions I get for women coming to talk to me about breast augmentation. How do I figure out what the right implant is? Or how do you figure out what the right look is for me? And that's a great question because the right look is not the same for everyone. Many women tell me they want a natural looking breast augmentation, and that's fantastic. That is always my goal. But my primary goal is to figure out what's natural for you because no two women are the same for exactly what they want, what their body is, what their skin envelope is, and kind of what all the endpoints are that we're trying to satisfy for. So I always do at least three things in every breast augmentation consultation to try to get inside your head as much as possible. One, we use a sizing kit. So those are sort of like fancy chicken cutlets that are inserts for a bra that correlate to actual implant volumes. That gives me an idea of what you're going to look like in that favorite piece of clothing, the tank top, the fitted shirt, a dress, whatever it is that you want to fill out and feel comfortable in. So that's step one to talk about volume. Step two is I'm going to do a 3D recreation of your chest with a program called Chrysalix. This is a virtual reality creation of your actual body and anatomy. And what that does is allow me to show you that volume on your body and what that looks like. It also gives us an idea of what you look like with a lift, without a lift, and also different projections. And the third piece of this component is I always have patients send me inspiration photos. Obviously I can't give you someone else's body. If I could, I would have taken Hugh Jackman's a long time ago. But I can get an idea of the aesthetic that you like. And so I'm getting the idea of what looks good to you because that is what we're solving for at the end of the day. And that aesthetic from these photos help me to tone down and also like fine point the areas of projection and volume to a much more specific area for you. I actually take those inspiration photos and print them out and hang them in the OR because I want myself and everyone in the room to know that this is this patient's goal. It's not the patient before her or the patient after her, but the patient in front of us now, this is what we're trying to achieve. And that's my goal for every single patient that comes to see me for breast augmentation.